Grieving parents want answers in death of 6-year-old Jasher François.
Good evening, everyone. So, my name is Jasher François. This is my wife, Amy François. I'm doing this live today to raise awareness about how my son was taken from me today. Right? His name is Jasher. Right? He was 6 years of age. Right? So, yeah, you will have to. Now come here.
Guys, everybody that is seeing this, as a grieving mother and a grieving father of a 6-year-old boy that was taken from us. A healthy 6-year-old boy. Never sick. No illnesses. Today he was taken from us after he was admitted to the hospital for a simple cough. Today, anybody that has empathy, that can understand the loss and the hurt that parents feel when they lose a child in a senseless way where your child is ripped away from you, I would like you to share this live. Please, we are begging you because we need your help. Hashtag justice for Jasher. I'm calling on the relevant authorities. I'm calling on the Honorable Kamala Prasad, the Ministry of Health, to launch an investigation into the death of 6-year-old Jasher François that took place today at San Fernando Teaching Hospital. My son yesterday, after I came from work, he had a cough on Sunday that persisted. He did not have any other flu-like symptoms, no vomiting, no coughing, anything. So my husband and I decided that we will take him to the hospital for the dry cough. Yesterday, we went to the accident and emergency at San Fernando with a referral letter from our Roy Joseph Health Center. On admitting my son, he had an oxygen level of 90 something. And they decided to give him oxygen to see if they could bring it to 100. But on going there, they said that they didn't hear any wheezing. He is not asthmatic. There was no cause for alarm. Okay, so they said they wanted to keep him overnight. My son was warded after 12 this morning. The doctor sat with both my son and I. He was able to answer all the questions, his date of birth. When they asked how he feeling, he was like, good. His only thing was, I'm sleepy, I want to sleep. And the doctor and I kept saying, 5 more minutes, you will go to sleep. I spent the night with my beautiful son. He was fine. I fed him. He slept because he was tired. Throughout the night, the doctors came because the only thing that they said they're going to give him, put him on the nebulizer to bring up his oxygen to 100%. Because when he was warded that evening, it was on 90-something%. Then it went down to 88%, and they just wanted to bring it up to 100. There was no alarm that said your child is in critical condition and he may die. There was nothing like that. After 6 this morning, the head doctor of the pediatric department came to do her rounds with my son with 3 other interns. Today she told me that it was 2 interns and one was her fellow something, I can't remember the word. When I spoke with the doctor, there was no cause of alarm that my son wouldn't be leaving and coming home with me today. She said, Mom, it's flu season and we have a lot of kids coming in with a cough. We're just going to put him on some antibiotics, keep the nebulizer going, and we want to add the oxygen and the nebulizer to make sure that his oxygen level goes up to where it's supposed to be. At no point did they say to me, hey, your son is in a critical condition. Hey, you need to call your family members because we think your son will be in distress. I woke up, I brushed my son's teeth for the last time. I fed him. My husband was at home with his brother. And he came to relieve me after 7. I came home to take a bath and before I could have done that. My husband was calling me, you need to
after it happened, my wife stayed with him overnight after he was admitted, right? And he was warded on Ward 11 of the teaching hospital, the pediatric section. I came there this morning. My son was normal, right? Apart from the little nebulizer and the stuff they was giving him because of the dry cough and he will get a lung infection, right? Something which he was admitted to before, and he was normal. He was talking to me, but he was asleep. So when I came upstairs, my wife had to leave shortly before, right? When I came upstairs, the doctor explained to me, okay, we're going to give him some antibiotics, some medication, and more nebulizer. But he should be fine. It's flu, same thing, it's flu season and that kind of stuff. I say, okay, no problem. So when I sat there and the nurse came, well, he had already had an IV in his hand, he was getting liquids, right? And the nurse came with a syringe and a vial to administer some medication through the IV. Normally, I don't really question the medical professionals as to what exactly they give him a son. Once they say like his antibiotics or his nebulizer, you know, I need to know basis. Shortly after she administered that particular medicine through the IV, my son wake up one time and he started complaining about a burning sensation in his hand. Explaining himself to me that daddy, it burned in my hand, it burned in my hand, it burned in my hand, dada. So when I called, I said, nurse, what's going on here? And he started crying frantically. Right? I said, nurse, what's going on here? So when she see the discomfort he was in, she stopped the medication. So and then now that prompted me to ask what was the medication he was giving my son.
Magnesium sulfate.
And she called it magnesium sulfate. I said, okay, no, I'm not going to question the nurse as to, you know, but I just asked the nurse, I said, okay, is it normal for children to get that kind of reaction to that type of medication? And well, at that time, she thought it was probably the position of the IV probably needed to adjust or change. So she took off the IV, stopped the medication, and immediately thereafter my son came back to normal. And he talking, oh yeah, well he vomit. The medication causes the vomit, right? So when she stopped the medication, when she stopped the magnesium sulfate through the IV now, he come back to normal, but I said, Jasher, stand up. I had to take off his jersey and a jacket and clean out. He stand up on the bed normal. I took off his jersey, when I give him instructions, move your hand, he talking to me normal, and he said, Dada, when mommy, he asking for mommy, when mommy, you know, Dada, I want to go home. You know, that the kind of question that, and we talking normal. So he come back to normal, he wasn't crying again. So when I finished changing his clothes to give him a nebulizer, he was breathing on the nebulizer normal, he was lying on the bed normal.
His oxygen level was?
The oxygen level was 95%. No cause for alarm, the pulse was normal. Well, according to the machines I had him connected to, you know, it was a normal day. He wasn't that critical patient to say, well, you know, doctors are in and around him 24/7, you know, and the doctors didn't relay any such information to us to say, well, you know, your child in critical condition, you know, he might make it.
He showed no anxiety.
No anxiety, but it was just a normal day at the office. The nurse came back now, and the nurse claimed that she was advised that children normally react irritably to the magnesium sulfate, and it's okay, you can leave it and let it go. It's only for 20 minutes anyways. I say okay, trusting the nurses. So immediately after she started by that magnesium sulfate injection through the IV, my son started showing discomfort again. He started showing discomfort again, but I talking, I said, Jasher, relax. That I hurting my hand. It hurt in my hand. I said, no, she said, no, leave it now, let me stay still. I said, well, okay. And I talking to him and I comforted him. But then now, I noticed when the nebulizer finished, well, it was almost finished, she said, switch back to the oxygen. But I find out but I thought he was sleepy. I thought he wasn't getting sleep. Right, so he's when she started back in this, as I forgot to mention, he vomited again 3 times. He just vomited.
Let me interject here.
And he talking to me, he said, Dada, I want to vomit. Dada, vomit. And I put in the bag by him and he vomited. Go ahead.
And the notes that the doctor would have taken in accidents and emergency when we were admitted, we sat with the doctor for over 50 minutes, and in those notes, there is proof that I said since he started coughing, he had no vomiting, no runny nose, no fever. So this vomiting, my child was not vomiting. I can't tell you the last time my child vomited. Yeah. So this vomiting was brought on
by that medication. Right? After he vomited 3 times, as well, the medication still going, as he lay down on the bed, I think he fall asleep. Well, you know, I think he was just feeling a little drowsy and he falling asleep. Another nurse now came and she said, why his posture like that? Make him sit up on the bed more. And that is when I push him and I realized he I still think he's sleeping. The nurse who pick up on it now and noticed he was unresponsive and started vigorously shake him up. And she raised the alarm, and well, by then about 10 doctors came, and you know, they said, I was immediately pushed aside. The doctors, well, they sent me senior pediatrician and some other doctors came, and they were literally trying to resuscitate my child. Right? From over here in the conversations, they was asking for adrenaline, they was asking for they raised the oxygen flow to over 100, and they was doing CPR. It was on my child, and he was totally out of it. He was already gone. Right? What I saying is today, I don't understand how a child could transition from being responsive, alert.
He was running and playing
before even the day before he was running and playing, to this passing away in an instant like that.
In 10 minutes.
Especially after you administer a particular medication to him, and he had an immediate adverse reaction to that particular medication. What I call it for is a thorough investigation into the death of Jasher François at this Justice by Jasher at the San Fernando Teaching Hospital, Ward 11. I call it for no stone to be left unturned. I want a comprehensive report to be done. We have to get justice. This is not right.
And I would say, when my husband called me, I was now going to take a shower. He said, you didn't to kill me, child. I couldn't believe it. I went to the car. I didn't even know how I reached upstairs. I jumped out my car, security guard. Had to drive back. It had no parking. Imagine I told the security, my son, unconscious. She said, there's nothing I can do for you. I had to drive around for over 10 minutes. Until my husband called and said, he died. And I jumped on my moving car. And it's the security guard. Thanks to whoever she was, she drove me. I didn't even know how I got back my keys. And when I went upstairs, the lifeless body of my healthy 6-year-old baby that I just left, and we just talked, and I told him I'm going home and make broccoli for him, his favorite vegetable, and bring it back. When I reached, blood coming out of my son's nose. His chest covered in blood. My healthy son that I just left. Over 30-something doctors and everybody stand up, and I want to tell you something now. Yeah, the conversation that taking place over the lifeless body of my son. One of the doctors was at his head, performing whatever procedure, and his response was, yesterday was a bad day to do legs, because he was continuously performing CPR. I had to beg them not to give up. Then I had to say everybody was just standing around with their hands full. And I said I had to have the courage in the midst of looking at the lifeless body of my son to say anybody here actually trained or have experience in resuscitating persons and children. And then they said, yes, just one person. And let me show you the person who was stand up like this. She's the head of the ICU, and this was a posture. No empathy. No anything to say, well, Mom, your healthy baby boy is gone from you. This was their posture. we don't know the things, and that's why we are reaching out to the relevant authorities, those that can help us, because when we asked for independent autopsy to be done, they said that we cannot get the body and they have to do one, and we would have to bring in somebody. The person that we reached out to, the only independent person that was recommended, is also associated with the San Fernando General Hospital. After calling around with persons, they said the only way to get an unbiased one is if we get into the forensic science complex, and I'm begging, please. We just want answers. If my child was ailing, I wouldn't have been here, but my child was healthy. My child is not a sickly child, in so much that when they ask if he has a pediatrician, no, because my children don't get sick. It was just this flu season. He gets the cough because he just came, and I explained this to the doctor. I said he was in 3 months of camp, and she said, yeah, well, interacted. And this is how casual the conversation was. I came home thinking, okay, by this evening, and I even told his brother, your brother coming home this evening, because that's how the doctor was relaying the information to me. And then when we started speaking after my son's demise, then she started saying, well, no, he was in moderate distress. I said, but that was none of the conversations that you relayed to me. He said, well, yes, it's just flu season. All the kids have it. When I said he just came from 3 weeks camp, she said, well, yeah, being around the other kids, that's the story, girl. And we just sat there and talked, and she was like, okay, well, this is the plan, mommy. I'm going to give him the Tamiflu or something like that they're giving all the kids for the flu season. And we're just going to put him on antibiotics and keep him on the oxygen till his levels come back up, and then we'll discharge him. So please, I'm begging each and every one of you, like and share and tag anybody that can assist us in this matter. We are calling on all the relevant authorities, from the head, from the Ministry of Health, from the head of the San Fernando Teaching Hospital. We are asking you, please. We have requested under the Freedom of Information Act a copy of all the notes of the admission of our son, of everything that was given to him and administered to him today that led to his demise. The heartache that we feel. What can I explain?
We are not medical experts by any stretch of the imagination, but the way my son was taken from me in front of my eyes, it was not.
He was ripped away from us. He was ripped away from us.
Yes, that wasn't normal.
He was ripped away from us. I left my son. I said I'd coming home to bed and to make some broccoli for him, and for my husband to call me. When I told he calling me to say, don't forget this for Jasher, he called me to say, you need to come down to kill me, son. It's worse than a mother don't ever want to hear.
The fact remains that before the administration of that last drug that they gave prescription to, the child was fully responsive, right? His vitals was good, right? His vitals was really good. How it is that after the administration of the drug, within 10 minutes, the child was completely dead, right? We also have pictures to show where his body was on the extreme, bleeding through the nose, blood all over the hospital floor. It was truly a traumatic experience, and we're asking for proper forensic investigation into what transpired in that hospital today. Yes. Right? So we really need you all to spread this and push this out, because we really want justice. We didn't really lose a mother and a father lost a son here today. I lost a nephew. We all lost a nephew here today. And this is an amazingly sweet child.
His big brother lost a little brother.
He lost a little brother. Yeah. He was not a sick child.
2 years after.
He wasn't asthmatic. He wasn't wheezing. He just had some cold in his chest. Oh, it is he dead now? We just asking for investigation.
We asking for help.
Please.
Share, put it out. We need help.
Put it out.
Justice for Jasher.
All the relevant authorities, please help us.
This is Jasher.
This is Jasher François, my healthy son.
This is him for his graduation.
6 years old.
6 years old.
Are we going to get into the habit of, by the means of malpractice, murdering our nation's children?
Much is enough.
Enough is enough.
Enough is enough. This human sacrifice.
And we are not going to leave any
stone
until we get an answer to exactly what happened here today.
So guys, anybody with children, people who understand this situation, you may not be able to even understand it. Having a child ripped away from you like that is something that It's unthinkable.
Undescribable.
We win my shot on me worse than any.
So in closing, please, any relevant authorities that can reach out to us and help us, please. Please. We're trying to get our son
Justice
to the
for
forensic complex for unbiased
Independent
and
autopsy.
independent autopsy.
Right? We want to stop the cover.
What is inside that drug? What drug they put in that little boy's body? What drug they put in his body to make him bleed through his nostrils? That shut down his respiratory system. Oh
And
my
That's a
God.
healthy 6-year-old
Child.
child that was just speaking, that was standing up, that his
What's
father just changed his clothes. He just ate before I left. I can't tell you the last time my son vomits, he went from being healthy to vomiting to dead within 10 minutes.
The health system's supposed to be a place where it's secret dress. Where we're supposed to have some sort of comfort that when we're sick, and we could go and get proper medical assistance, for our loved ones. If this is going to be the norm and we're gonna just let it slide, well, we heading even deeper. We're falling even deeper as a nation.
So that,
Yeah, so
Kamala,
Kamala
you're calling on Miss Kamala Bissessa. You are the mother to the nation at the moment.
one of
And
which-
from a mother's heart to yours, please.
Minister of Health also the people of San Fernando West. Mr.
The MP
Mr.
for
Lowland.
San Fernando West. We are asking you to please assist us in this matter. Please. I'm asking everybody again to like and share and repost and let's bombard the timelines. Let's tag all the relevant authorities. Justice for Jasher.
Justice for Jasher. Justice for Jasher. Justice for Jasher. Justice for Jasher. Justice for Jasher. Have a blessed day, everyone.
Excellent.